Assalamualaikum and hi, my name is Hazira Binti Razak and today I will be presenting my paper titled The After Effect of COVID-19 Towards the Mental Health of Universiti Sains Malaysia Student. Hope you'll be enjoying my presentation for today. First and foremost, did you know that WHO has officially made the COVID-19 being recognized as an ongoing health problem and does not qualify as a public health emergency of international concern? But despite of the announcement and how we can see that COVID-19 has been integrated in our life, it seems to be still had an effect on our mental health state, especially as a university student. Yet, at the same time, all this COVID situation has somehow raised the awareness of the different impacted group mental health regardless of age. In a recent examination of the virus outbreak and pandemic, concern, annoyance, boredom, limited resources, insufficient information, financial loss, and stigma were highlighted in this issue. Therefore, this research paper will be broken down into three aspects, which is the effect of COVID-19 towards mental health of students based on the academic, health, and lifestyle. As for the literature review part, I'll start with the academic and COVID-19 aspect. Back when the lockdown is still enforced in our country and changes happen in the education institution and system, research found that there are only 19.6% of students choose physical classes, and in the meantime, there are about 50% of students prefer online classes. But currently somehow, due to the change of education environment back to when before the COVID-19 hit, some students can be seen still struggling to adapt with the environment changes that indirectly has impacted their mental health. Next is on the health and COVID-19 issues. The COVID-19 and health issues are closely related with the long COVID or better known as post-COVID conditions. Any kind of signs, symptoms or problem that are persist or worsen after the initial infection of the virus are known as long COVID. COVID-19 may not only cause various psychological symptoms, yet it also could have led to a new health problems such as diabetes, heart problem, and blood clots to the people who contact the symptoms of these post-COVID conditions. And as for the lifestyle and COVID-19 aspect, the pandemic may have raised awareness and inspired to a healthier lifestyle choice, but at the same time, it also has resulted in a sedentary life behavior, unhealthy foods, and unhealthy sleeping patterns. This is due to the fact of disturbance of the daily routine that are caused by working from home, participating in online learning, and limited outside physical activities, which resulted in boredom, eating more energies and calories, isolation, limited social interaction, and outdoor activities. Some students seem to be adapted to that kind of lifestyle, and since we are back to the old normal, some students also found to be struggling to be adapted back to the lifestyle and indirectly has impacted their mental health conditions. As for the methodology of this study, this paper has been using the quantitative approach in order to collect the data needed for the study. A questionnaire survey was utilized as a tool in gathering the information required to complete this study efficiently and to meet the time strain of the paper. In administering the online survey for this study, I have been using a Google form as a tool in gathering the required data. And the target audience of this study is Universiti Sains Malaysia students who are still got affected with the COVID-19 experience on their mental health. And this questionnaire is also being distributed through various channels of social media in order to ease the access of the questionnaire through the targeted respondent. Also, in analyzing the data of the study, the statistical package for social science SPSS has been used. The SPSS been utilized in this study since it works the best to test both measurement and structure model for the data gathered. So here is the result of the study conducted. To be noted here, the p-value of this study is less than 0.001. The result shows that the academic and mental health perspective still have an impact on the mental health of students since COVID-19. The beta value of 0.502 indicates a positive relationship. Therefore, the hypothesis saying that the academic and mental health have a significant relationship since COVID-19 is accepted. This is due to the fact that during the online classes session, students have been facing a lot of mental health challenges such as loneliness, anxiety, and depression. For the next aspect, which is the health and mental health, the beta value of 0.5013 shows that there is a significant relationship between health and mental health of students since COVID-19 at the p-value less than 0.001. there is a higher chance of mental health issue, stress, and functional impairment as a result of underlying physical health issue. In addition, mental health problems are particularly significant to the COVID-19 patients as they may do not fully recover after a year of infection. And for that reason, the hypothesis of there is a significant positive relationship between health and mental health of students since COVID-19 is accepted. And lastly, the aspect of lifestyle and mental health. The beta value obtained is 0.506 demonstrates that the lifestyle does still give impact on the student's mental health. Therefore, the hypothesis of the lifestyle and students' mental health since COVID-19 have a positive relationship is accepted. This is because during the change of lifestyle during COVID-19 restrictions, it can be found that students are vulnerable to a high mental stress which resulting from the increase of weight due to the increase of calories intakes and lack of the quantity and quality of the sleep. The finding of this study can be concluded that the after effect of COVID-19 towards mental health can be studied into three aspects, which is the aspect of academic, health, and lifestyle. All those aspects act as the variable and was proved to have a significant positive relationship towards the mental health conditions of USM students since COVID-19. It shows that the impact of COVID-19 in the aspect of academic, health, and lifestyle that are experienced during the restriction back then are still existed and can be felt until today by those who are impacted by the pandemic. In addition, the pandemic seems to have arisen the awareness of the importance of the mental health in every stage of age, especially the students, due to the change of environment since COVID-19. And additionally, lots of mental health issues are able to be discussed openly without any stigma from society, and a lot of initiatives also seem to be available for those who actually need help in terms of mental health. And that's all from me for today. Thank you.